So I've done this for nearly 8 years. Yes, the models have been changing, bending and stuff throughout the years, but um, there's, the students walk out of there and say, no, that was a fair test. He didn't trick us or anything, so don't worry about that. All right. But we only have three, so that's only 3 stations. So there's a lot of other models to consider, and they're scattered all on your tables, all the other ones. Okay, so you just gotta try and come in here when you can to look at things. If you want to take pictures and then look at it at home, there's a lot of models of the blood vessels. Okay. Now, the other thing that this test is going to assess on is that thing called the trace question. Okay. The trace question, I'll talk more about it when we've gone through all the blood vessels, which will take a couple days to do. The trace question, just to alert you what it is that it's going to be, I'm going to point to 2 points, or I'll tell you 2 points. I'll say like the left wrist and the right wrist and the left ankle. And you got to tell me all the blood vessels going to the heart, the whole heart, which you've done before, and then all the blood vessels going to that ankle. Now, it sounds scarier than what it is, because from your wrist to here it might only be about 6 blood vessels. It's not, it looks like there's a lot here, but it's a lot, the bite is worse than the bark. No, I'm sorry, the bark is worse than the bite. All right, so it's not so bad. But no, don't worry about the trace question until we go through everything, because right now, you're overwhelmed. I know you're overwhelmed. So I just want to let you know that's going to be on the same day as your practical exam. The practical exam, 50% of it is going to be blood vessels. So you might as well just do the trace question on the same day. It's the same test. All right? Why should you have it the following week and have your anal sphincter being tight for 2 weeks? All right? Just do it all at one time and call it a day. Okay? It's the same. You're testing the same stuff. And that test will be, so the practical exam is I think it's 100 points the way it's set up at this school. And then the trace is 45 points. It's 15 points going to the heart, 15 points for the heart, which I'm hoping everyone gets 100 on that part. We've done that before. And then 15 points going away from the heart. I said points, not parts. All right, and I'll explain a little bit more about the trace question when we're finished with all the blood vessels in the next couple of days. All right, but I just want to alert you, you do have that also. Okay? Any questions about at least the introduction of this and what to see? Okay? All right, so let's get into this, and I'm going to do a lot of art therapy up here. Okay? So the blood circulation, which is basically just the anatomy. You had 4 lists, or there's a total of 4 lists in A&P. Histology, bones, muscles, and now blood vessels. So just getting another list should not be a shock to you. In fact, most of you have already heard a lot of these words, and you could probably point to them. For instance, point to your femoral artery. Go ahead. Point to your brachial artery. Point to your axillary artery. Right, the armpit. Good. You see what I mean? Like the names, that's why blood vessels are not so bad, because a lot of the words kind of make sense. The only thing is, it's more of where they're coming from. Now, what I usually refer to people with, or how I try to teach this, is think of a map. And that's what this is going on. I mean, it's basically one road, and then you got branches that are going out. Now, gradually, year by year, I say the word map, and 8 years ago, there's no problem. Now, I'm finding like maybe a third of the class don't even know how to read maps anymore because of friggin' GPSs. So, that's, you got, think of it as a map. That's the best way I can do it. If you don't know how to read maps, this is in a course about maps, but it's the really only thing what's going on. And I think that if the people that are going to what's the word I'm using? People are going to struggle less, the people that are going to struggle less on the trace question are the ones that know how to give directions. Okay? And I'll show you what I mean by that. And you know what I'm talking about. You have people that like, oh, don't ask her for directions. I'm not saying those people are going to do poorly. I'm just saying those people are going to struggle more because there's a lot of blood vessels here. And if you don't think like maps, like where you make, I'm going to make a right-hand turn before the traffic light or after the traffic light. The traffic light is the landmark, and you're going to see landmarks here where the branch is. Is it before or after that landmark? That's what I'm saying. If you know how to give directions, you're still going to struggle, but you're not going to struggle like other students. Does that make sense? All right? Just think of it like, and I'm assuming everybody here drives, so I mean, or at least got to school by a car or something like that, so you know about roads and which way they go. Okay? All right, so let's talk about blood circulation, and this is the lab portion. So I'm not going to talk about blood pressure. I'm not going to talk about blood flow or resistance. That's all lecture stuff. We're just talking about the blood vessels here, the veins and the arteries. So this is the peripheral circulation. All right, we're going to talk about all these and then some. Okay. Peripheral circulation, it carries blood, exchange of nutrients, it's going to transport all the hormones. You probably know all this stuff. There's various molecules that are in there for coagulation, enzymes. You'll learn all about those in lecture. And it helps regulate blood pressure and directs blood flow. We have sphincters on certain capillaries. They will constrict and it will not allow blood going into certain areas. For instance, if a bear is chasing me, I don't need to have blood going into my intestines and start digesting food when a bear is chasing me. So instead, the sphincters of the capillaries are going to constrict there. Less blood goes to the stomach, and that's why you get that funny feeling, butterflies in your stomach when a bear is chasing you, or whenever you get nervous. And the blood is then shunted away and goes to someplace else, like your legs, so you can get the heck out of there, your brain, so you can think about things. That's what's happening over here. So it could shunt blood differently, okay? So blood vessel types. There's 3 major blood vessel types. We have arteries, and you'll learn in lecture about the 3 subtypes of arteries: elastic, muscular, and arterioles. We also have veins, and there's 3 types of veins. There's venules, small veins, and medium and large veins kind of look the same. They kind of act the same, but different layers. And then you got capillaries. Again, arteries carry blood to the heart. No, I'm sorry. Arteries carry blood away from the heart. Artery away, AA. Veins will always carry blood to the heart. Think of to the heart, veins, TV, like television, okay? And then capillaries is very small. We're not going to talk much about these. We're going to concentrate more on arteries and veins. But capillaries is where the gas exchange happens at the tissue level. They're very thin, and oxygen comes off and carbon dioxide comes on. But what you should also know, basically the way the order is. We have arteries here going to arterioles, to capillaries, to venules, and you got veins. Veins have valves in it. And valves, as you've seen with the heart, it ensures one-way blood flow. You see, what happens here is that blood is going to be going through these blood vessels from the heart back to the heart. Now, if you take a bowling ball and I roll it down here, the highest pressure is going to be at where it came off my hand. The lowest pressure is all the way at the other end. Right? It loses its momentum. So therefore, the pressure is highest here, right where it left the heart. So the aorta, the main artery, is going to withstand the highest pressure. So there better be a thicker wall when it deals with the aorta to withstand that blood pressure. By the time you get to the veins, it's lost its momentum. It's like just chugging along. So we're going to have issues trying to get blood back up to the heart because the blood pressure is so low. So that's why we have valves in the veins, so that when the blood goes up, it won't go backwards. Now let me ask you this. Where is the lowest blood pressure? Let me give you multiple choice, and then I'll ask you which one. The lowest blood pressure found in the circulation. The aorta, arteries of the arms, veins of the arms, arteries of the legs, veins of the legs, or the inferior vena cava, or the right atrium. Okay? which is going to have the lowest blood pressure? We'll make it easier. We'll say all veins. So we'll say aorta, veins of the arms, veins of the legs, inferior vena cava, or right atrium. Who here says the aorta has the lowest blood pressure? What about the veins of the arms? The veins of the legs? The inferior vena cava? The right atrium? It's the right atrium. The right atrium has 0 blood pressure there, unless the atria actually contract. It's the end of the road. People are thinking legs, but believe me, if the lowest blood pressure is down by the legs, the blood is going to stay down there. Does that make sense? So there's some pressure to try and get it up. But by the time we get to the end of the road, the right atrium, it's virtually 0. Okay? So we do have gravity fighting us down where the legs are. So we have a lot of valves down there in the veins to make sure that the blood doesn't go backwards. And those valves, if there's too much pressure there, the valves open up, and that causes varicose veins. Okay? But it's not the lowest down there. You're just thinking that because it's the furthest from the heart. But if it was the lowest, it would stay down there. It wouldn't come back up. Right? Okay. So that's why we have valves there. Okay? Now, there's different layers. I'm not going to spend time on this, but you do need to know it. Let me just grab this. Because we have this model here. All right? And it's pretty straightforward about the levels, or the layers. This is a vein here. This is a vein here, and you can see some valves there. This is an artery here. So you just have to note about the different layers. This will be on the at least the practical this school. Okay? So I don't want to spend time talking about that because there is just rote memorization of different layers. They're called tunics. You'll learn about them also in lecture 2. I want to spend time on the harder stuff, the names of the blood vessels throughout the whole body. Okay? So it's just showing you the artery. You can see how thick it is because it's withstanding the highest blood pressure, and the vein is going to hold more blood there. Okay? We have more veins than we do arteries. You're going to see there's superficial veins and superficial arteries, which is important to know as we go along with this whole story here. Think of an artery more like a garden hose. It stretches a little bit, okay? But a vein is more like a fire hose. We have a lot more blood sitting in the veins because, like I said, the blood pressure is very low, so it's going to sit there longer. 65% of your blood is sitting in veins. The momentum in the arteries is going very fast. The blood flow is going very fast in the arteries. So it's not going to sit there that long. So we have, as we go along with the arteries and veins, we are going to have like virtually 2 sets of veins for the arms and the legs. The arteries, we only have 1 set. So it's going to seem like, and not seem like, we are going to have more veins than there are arteries because of that reason. Okay? And again, it's just showing you artery and vein. You won't have to worry about the microscopic view of it, but just showing you. Okay? All right. Now, we have these things called anastomoses, which when you're driving, if there's a roadblock, there's another way to get there. In other words, to get to my hand, I have an artery here. All right? That's called a radial artery. And I have another artery going this way. That's the ulnar artery. So we have 2 ways that we have to get blood supplied to our hand. If there's a roadblock over here, blood can still get to my hand. There's an anastomosis. There's another way. There's like, for me to get from here to, let's say, New York, we could take 3 or 4 different ways of getting there. That's where it could get a little confusing. That's why it looks like the Spider-Man is like it's all over the place, because we have a lot of different ways of getting there. All right? So we call those anastomoses. And you're gonna. That's why when we do the trace question, if I ask you to go from the thumb to the heart, so to say, I'll have like 2 or 3 different ways that you guys can do it. Just pick one. You know, it's like a direction. You know, hey, you want to take the back road? You want to take the the fast way? So, you know, if I ask for directions, and you do this all the time, you know, people, when you ask for directions, if you ask 3 different people, they'll give you 3 different ways. And I don't care which way you give me for the trace question. Just get me there, okay? You want to take the long way? That's fine. I have no problems, okay? Now, let's start off with what we already know, okay, and then expand with that. The pulmonary system, you already know, right? The left heart, the right heart, all right? The left heart is going to pump it throughout the whole body. The right heart is going to pump it to the 2 lungs, and then from the 2 lungs, it's going to push the blood into the left heart, and it goes out that way, right? Basic stuff. Let's just expand on it. So this is what I just showed you, the gray area. Now we're just going to extend more blood vessels upwards. We're going to extend it downwards. Here's the diaphragm, and goes down into the abdomen and into the legs. We're just expanding with it, okay? Don't let the names, don't fight the names is what I'm saying. A lot of the names, if you've seen, make sense, all right? We have something called the carotid artery. Carotid means head, all right? So we have the carotid artery. It's going to go up to the head. We also have jugular veins, and that also means head, okay? Now, this is where, I have that list that I told you about up there. There's no such thing as a jugular artery. There's no such thing as a carotid vein. I don't know why they didn't just use the same one for both. So jugular only refers to veins from the head, and carotid arteries are only referring to arteries to the head. So you just have, and I'll get a handful of people, not a handful, like 1 or 2 people saying, oh, that's a jugular artery, when there's no such thing. Same thing as a carotid vein. So that's a little, you have to accept that until I die and deal with those people up there who came up with this thing, all right? Subclavian, that means under the clavicle, and that's going to go to the neck area. We have brachial, that goes arms, iliac, right? That's going to be your pelvis or hip. That makes sense. Femoral, as you showed me before, is legs. So the names are going to help you, okay? Some blood vessels go to areas and the names are going to be similar to it. In other words, we have a hepatic artery. Hepatic means liver, so that's going to go to the liver, like hepatitis, okay? Liver disease. Meningeal. If you remember the meninges, the coverings around the brain. Well, this is a blood vessel. It's going to go to the meninges, the meningeal. Sometimes they'll be just, if you know about chapter 1, just in terms of parts of the body and directions. Dorsalis pedis. Pedis means foot, like a pedal. And dorsalis is on the upper portion of it, the dorsum of the foot. Okay, so it makes sense. Superior mesenteric. You might have not heard about superior mesenteric, or mesenteric for that matter. But guess what? If we have a superior mesenteric, guess what else you got? Yeah, okay? If there was only one, they would have just called it the mesenteric. So that's what I'm saying. Don't fight the names. They're going to make sense to you. Okay? You just got to draw up the maps. Okay. So let's start off with what we already know. All right? So I'm going to do a lot of drawings up here. You could you'll watch them on the video. You could draw them with me. You could, and I'll let you even, like, just before break, if you want to take pictures of this and save it that way too. Whatever works best for you. Okay? All right, so let's do this. Okay. the way this is broken down, no more are we calling this just the aorta. Now the aorta has a few parts to it. Okay? We talked about this. This is going to be our ascending aorta. This is going to be our aortic arch. And this here has a few different names. Going from where the aortic arch ends to the diaphragm, this is known as, and I'm going to just abbreviate, you wouldn't abbreviate for your exams. I'm going to abbreviate 1 to speed up time and 2 so it's not so messy up here, okay? But everything is written up in my slides here. This is what we call the thoracic aorta. From the place where the diaphragm is until where it bifurcates into 2, that's called the abdominal aorta. Or we could just call this whole thing from here to here the descending aorta. Okay? Now, if you're going to do the trace question, I'll show you what you can do and what you can't do. Let's say you want to get down here. You could say ascending aorta, aortic arch, thoracic aorta, abdominal aorta, and then down here. That's fine. Or you could cut time and just call it this: ascending aorta to aortic arch to the descending aorta to down here. That's fine too. What you can't do is call this the ascending aorta, the aortic arch, the descending aorta to the abdominal aorta. Now I don't know if you know what you're talking about. Are you saying the abdominal aorta comes off the descending aorta? Do you realize it's the same thing? Does that make sense? It's like how a road is named Main Street, but it's also Route 506. You know, you're not going to say, well, you're going to get onto Main Street and then you're going to go into 506. When it's the same road, you're going to confuse that person. Does that make sense? Okay? So no questions about that? Okay. This bifurcation where this happens over here, most students, when they first see this, they're thinking like, well, that's where the groin is. No, no. It's where the belly button is. It's much higher than what you think. It just looks like 2 legs, but it's much higher. It's here and then goes down. So that's where the bifurcation is. And you can see that on that model over there, the big torso, that's where, if you see the red here and the red here, right there is where it bifurcates, right where the belly button is. And when you go over there, you can see those, okay? It's not down here, it's much, much higher, okay? All right, now, let's talk about the branches coming off of the aortic arch. The first branch is the brachiocephalic artery. Again, I'm going to just abbreviate to speed up time. The second branch is going to be the left common carotid artery. The third branch is going to be the left subclavian artery. The brachiocephalic is going to branch off into 2 things, and that's where we got the right common carotid and the right subclavian. So this, God bless you, this is going to be the right common carotid artery, and this is the right subclavian artery. I'm sorry we're not symmetrical, but we just have to accept it. And believe it or not, 70% of people are built this way. 30% of people, believe me, they don't have the brachiocephalic, or they'll have 3 coming off of this, like the left common carotid comes off of this. I'm just teaching you the most common ways. There's anomalies, and you'll learn about those if you go into cardiovascular courses and stuff. All right, but I have to teach you one thing, and I'd rather teach you what the common thing is. Okay. Questions like that so far? Okay. Now, common carotid. All right. So it's not just the carotid, but you know it's going to go to the head. Whenever you see the word common, it's going to split into 2. One is going to go to the face, so outside the skull, and one is going to go inside the skull to where the brain is. The one going outside the skull we refer to as the right external carotid artery. The one going into the brain or inside the skull is the right internal carotid. Again, carotids are arteries. Now the left common carotid will do the same thing too. I'm not going to draw it there because it's going to look very busy, but they do that. The internal carotid goes into the brain. The external carotid goes outside the skull, as the name implies. Common thing I see, someone calling this the right carotid. I would mark that wrong, because I don't know if you mean external carotid, internal carotid, or common carotid. I also see this. They call this the right common internal carotid. I don't know what that is. You made a hybrid. Does that make sense? There is no such thing as a common internal carotid. Okay? So far, so good? Okay, now, there's a branch. First branch coming off the subclavian. And it goes, I'm going to use that as a curlicue. It kind of goes like this. And there's one that comes off of this one too. These two are also going into the brain. These two arteries go through the vertebral column. Through the cervical vertebrae, there's holes on the sides, the foramen. They're called transverse foramen, if you remember those. These are two arteries that go through the vertebrae to go into the skull, into the brain. What do you think these are called? They go through the vertebral column. Vertebral arteries. It's that simple. Okay? So this is going to be this will be the left vertebral artery. And that'll be the right one. Again, I don't need to label both of them, but that's what's going on. Does that make sense? Now, I also want to mention down here, the abdominal aorta bifurcates into two. This is going to be called the right iliac, the right common iliac artery. Okay? So what do you think? It's going to split into two. Do you know what they're called? The common iliac, the common carotid, the common iliac. What do you think this is going to split off into? Right, internal and external iliac. You're going to have one that's going to go into the pelvic cavity. That'll be called the right internal, this is going into the cavity, iliac artery. And then there's one that's going to go out of the pelvic cavity down the leg. And that's going to be the right external iliac artery. All right, it's not hard. There's a lot there, but it's not hard. Now, I'm not going to talk anything more with below the diaphragm. I'm going to save that for a rainy day. No, we're going to save that next time we meet. I need to go through what happens to these up here. That's what I'm going to do today. And what happens to the subclavians. So everything above the diaphragm we'll do today. Any questions about this? Okay. This picture looks weird and busy. I realize it, but you know what? We did it all. Everything that I put there is here. Let me show you. Go with the places you already know. Here's the left ventricle. All right, left ventricle. Here's the ascending aorta, aortic arch. It's 3 branches off the aortic arch. The branches off the ascending aorta is the coronary arteries we dealt with the other day. So ascending aorta, aortic arch, descending aorta. See, they're also calling it thoracic aorta also. The aortic arch has 3 branches. The brachiocephalic artery, the left common carotid artery, and the left subclavian artery. The hub, the place that you need. You'll know this area. When you do your GPS, you really don't need to know directions how to get out of your development, right? You know this area, okay? The brachiocephalic branches into 2 things. The right subclavian and the right common carotid. It's all right there. The right common carotid branches into 2 things. The right external carotid goes to the face, outside the skull, and the right internal carotid goes into the brain. The left common carotid over here does the same thing. Left internal, left external carotid. And they do what the right side is doing. Just on that side of the head though. Okay? You'll also see, coming off the brachiocephalic, is the right subclavian. We have 1 branch coming off of that, the right vertebral artery. And that too goes up to the brain. The brain has 2 major blood vessels. Well, 4, because there's 2 on the other side. The internal carotid arteries and the vertebral arteries. Those are important. You don't want to have either one of those having a blood clot there, because that's going to mean that there's less blood going up to the brain, which could lead to a stroke. Doctors can feel that over here or listen to it, your carotids. That's why they're concerned in your arteries in your throat. And they'll hear like bruits and stuff, sounds if there's any turbulence there. All right? Questions on that? It looks busy, but I did that with you. Okay. You know how like you're driving on the road and it's like Main Street and you're on the same road and they change the name to 506 and then you go into the next town, it's the same road but now it's called William Street or whichever. It's the same road, it just changes its name. Well, blood vessels do that too. The subclavian turns into the axillary artery, turns into the brachial artery. It's the same road, but there's landmarks. There's towns that actually change the name, but it's the same road. And then it splits into two, and then back into one over here. Okay? We'll get into that later, but I just want to show you it's just like roads and maps. This we'll deal with next time we meet. But here's the diaphragm up here. This is the abdominal aorta coming down, and all the branches coming off the abdominal aorta. We'll deal with that next time. And then it splits into two. Splits into two. This is where the belly button is. So here's the right common iliac, the left common iliac. Then you got the right external iliac and the right internal iliac. The external iliac gives blood supply to the leg. The internal iliac, which goes into the pelvic cavity, internal, gives blood supply to the reproductive organs and the urinary bladder and things that are in the pelvic cavity. Okay? Questions on that? Just an overview. Now let me show you something else here. I showed this before. The name just changes, or the road just changes its name, splits into two, and then goes into the foot, or I'm sorry, into the hand. All right? Now keep an eye on that and watch what happens. The road just changes its name, splits into two, and goes here. What I'm showing you here now, that's the leg. That's the arm. That's the leg. All right? It's the same system. So if you know the upper extremity, the lower extremity is going to be easy. We just change the name just to protect the innocent. Okay? It's not bad. Don't make it bad. Okay? There's a couple of caveats. We'll talk about posterior, anterior, and there's another one that pops off over here. But those are just extra features which we'll talk about. Okay? Veins. Pretty busy. We'll get into that later. All right? This is the diaphragm over here, and we got to talk about the veins above the diaphragm and veins below. There's more veins than there are arteries. We'll deal with that when the time comes. Okay?